Hi everyone, I'm here with Dr. Akkary and we're sitting down to do an interview style, asking him some questions about cosmetic procedures. Would you be able to introduce yourself, tell us how long you've been practicing?
Yeah, absolutely. So my name is Dr. Akkary, and I've been in practice for a long time now. Let's see, we started practicing in 2008, so been a while. And I did my medical school in Egypt.
Oh, that's awesome.
Yeah, yeah, it was great actually. One of the biggest medical schools. It was amazing. And and then I moved to the U.S. Around 2001 when I came here. Initially Philadelphia, and then a lot of different places. And I did my surgery residency in Michigan, and it was great. Love Michigan, just the weather was a little tough, you
Little
know,
cold.
yeah, a little bit. And then I did my fellowship. Initially, I did a fellowship in weight loss surgery and minimally invasive laparoscopic surgery, and that was at Yale. And after that, I came to West Virginia University, and I was directing their bariatric program at that time. I was doing weight loss surgeries and a lot of general surgery work, and it was great. It was a great experience. You know, shortly after we got the hospital to be designated as Center of Excellence, and that's something that we always do. We just want to make sure that we do things the best way possible. And I decided after that to go to private practice and community practice setting. So I worked with Preston Hospital at that time, and a lot of other hospitals also in the area. And we developed another bariatric program. And Preston Hospital also got designated as a center of excellence. I think in less than a year after we
Oh,
started
wow.
there, which was really a big achievement, you know, because we wanted to take a hospital that was of uh, I'll say small size, a challenging size. You know, great hospital, really, they do excellent work. But to have them certified as center of excellence, I think was a great achievement, and a lot of people put a lot of work into it. And then I switched to private practice. And for me, I enjoy doing weight loss surgeries, and I love doing body contouring, and it's something that I always had a passion for. So it came just very natural. So patients started to ask, "Hey, can you do my tummy tuck? Can you do some liposuction on me? Can you do this? Can you
Right.
do that?" And there was some surgeries that I was comfortable doing, and I was trained on. I was like, "Yeah, absolutely, I can do that." And then immediately after, it just started like picking up, and patients are very happy with the results, and they want more procedures. I was like, "Well, no, that's getting a little out of my expertise." So I decided that I'm gonna go do another fellowship. Sorry, and this fellowship was in cosmetic surgery, and that was in San Diego. Uh, Surgeon, his name is Dr. Robert Chumway, a great guy, one of the best surgeons, and uh, you know, with these fellowships, you do only cosmetic surgeries every day, cosmetic surgery. Okay,
Okay.
it's not plastic, it's not reconstructive. There's nothing like that. It's only cosmetic surgery, and it was a great experience. And it was through the American Academy of Cosmetic Surgery, which I'm very involved with, and I humbly serve on their board. And then after that, we started running the practice as bariatric and general surgery and cosmetic surgery, uh, and um, and then over time, you know, we decided to have only cosmetic surgery practice, and that's where we are now. And we do our procedures in an ambulatory setting, which I believe about 70% of cosmetic surgery in the country is done in an out of hospital ambulatory setting.
Right.
And uh, we have nice, diverse practice. We do face and body. We do a lot of different procedures that I'm sure yeah, you're gonna ask me about.
Yes. We'll get into
And,
all the different surgeries.
yeah.
You also have the med spa side of things as well.
Oh, absolutely, yes. Yeah, and we also do the procedures in our office-based surgery center, which we're very proud of. It's fully accredited by HHC. And, one of the things that we're very proud of is we have patients that come from everywhere,
Everywhere. Yeah.
you know. So we had patients that came as far as Canada, you
Wow.
know. We have patients that came from Florida, California, Maine, Arkansas, um, and of course the states around us. I think Kentucky, Indiana, Ohio, Maryland, Pennsylvania, and of course, from West Virginia. So we really appreciate that. Like
Yeah.
patients, they do their research, they talk to other patients, and that's the beauty of this. They don't wait for, let's say, their family doctor to tell them, go see this physician. They actually do a lot of research themselves. They talk to patients, they know what's going on, they look at social media, they look at results, and then patients travel, and of course we appreciate them traveling, that far to come and see
Yeah,
us.
that's incredible. That definitely says something about you, considering there's so many places that you can do cosmetic surgery, and I'm sure there's local places to them as well, but they're choosing to travel a very far distance, even as far as taking a plane to be able to have their surgery done by you.
Yeah, well, thank you. I really think it's the team, though.
Yeah.
Even though I'd love to take the credit, it's nice of you to say that, but I think it's the team because I noticed a lot of reviews on Google. The patients actually talk about the team and by name, like this person did that, this person did that.
I've noticed that as well. Like
Yeah.
even as far as your front office staff down to the nurses and then you, of course, but that makes
Right.
I would obviously want the whole entire staff to be super friendly and feel comfortable around them when choosing to have someone do an elective surgery on me. So
Yeah, and they enjoy what they're doing. Like I think that's a common theme here. Like it doesn't feel like it's work.
yeah,
Gotta go to work. Kind of feeling. No, we're just all here, enjoying what we're doing, enjoying working with the patients, enjoying being part of your dream body journey.
yes,
Okay.
your dream body.
And it's fun. We love it.
Well, no, your work environment definitely helps. They say if you love what you do for work, then you don't feel like you're working a day.
Exactly. Yeah.
So
I never work except
feels
when
like
it comes to paperwork. That's when it feels like work.
don't like the paperwork. But I definitely say you guys seem like almost like a family around here with all of
Yeah.
your staff, which is incredible. So in your practice, you do multiple different things cosmetically, as far as you can do face, body, breasts, things like that. What procedure would you say that you do the most here?
Oh, great question. Okay, so I would say, yeah, we do a lot of face, we do a lot of body. I would say our kind of routine procedures would be tummy tucks and breast dogs, very common in our practice.
And do you do those at the same time sometimes? Is that what's considered almost like a mommy makeover? People have heard
Yeah.
that term a lot.
Yes, so my makeover, you're right. It usually means contouring after pregnancy, after having babies, all that. And most of the time it is breast and abdomen, but it varies. Some patients might need breast aug only, some patients might need lift only, some patients might need both together, some patients might need some lipo, maybe not, maybe tummy tuck, maybe not, and so on. So it's
Yeah.
a very just generic term. But yeah, so we combine the procedures if it's safe. So we always focus on safety. Now, a lot of patients want to have the same procedures, or I'm sorry, different procedures at the same time, and we try to do that for them as long as it's safe.
Right. I mean, safety has to be the number one priority,
Right.
especially with something like this.
Mhm.
So that would make sense. You just said like breast augmentation, breast lift. That was another question I had for you. Can you explain the difference between those things? And I know I've seen that you guys practice something called like the
Tuzba,
Tuzba.
tuba,
Yes.
tuzba. Yeah.
And I kind of just I use the broad term boob job. I know that's
Okay. Yeah.
not,
That's great.
But I've always said that, and I didn't realize there were
Yeah.
so many different things that you could do. You can do a lift, you can do an augmentation, you can do the TUSPA. So what are the differences for all of those, and how does a candidate decide which one is best for them?
Sure. So in general, you can think of breast augmentation as just adding volume, making the breast bigger.
Okay.
Breast reduction, the opposite. Breast lift, that's more for a droop. So sometimes with aging, uh, and sometimes after pregnancy, breastfeeding, we have a droop, we start to have loss of volume, and sometimes just genetic, and then we need to lift the breast, and sometimes we need to combine, maybe lift and make it smaller, or lift and make it bigger, right? So there are a lot of different procedures. Now, let's say if we talk about breast augmentation, how can we make the breast bigger? Well, we always hear about implants.
Right.
So that's a great option. Then when we hear about implants, then we start talking about silicone implants and saline implants,
And
right?
there's a difference there.
And there's difference
Yeah.
there. And by the way, saline implants are made of silicone.
Really?
Yeah.
Well, that's
Just a
confusing.
fun fact, yeah.
It's confusing because they're kind of the same, but they're not.
Yeah, right?
Yeah. And it's, how does one choose which one they would want to have?
So that's a great question. A lot of different factors. Now, if we go over both implants, silicone implant is made of silicone shell.
Okay.
And filled with silicone gel.
Okay.
Okay? So you have shell and gel.
So there's two parts to it.
Two parts to it. So sometimes when we remove old implants that are ruptured, you can see the outer shell and you can see just the gel that is leaking out of the
Wow.
implant.
That is
Okay.
not something someone wants to deal with, I don't think.
Yeah, yeah. And that's why they say, oh, try to change the implants every 10 years or so.
That's a myth a question I had for you was, is that a real thing, where the 10-year rule where you're supposed to change out
It's
your
recommended by
implants?
the FDA.
Recommended? Okay, yeah.
So a lot of times patients say, well, why would I get surgery if I don't have any problems? And I mean, that's reasonable too. Why would I go under anesthesia, or why would I get surgery, if I don't have any issues with my implants? But of course, you need to at least follow up and make sure that you keep an eye on the implants and all
Right.
that, so you don't have any issues. Also, it's recommended to get an MRI every 3 years.
Okay.
Now, for saline implants, they are made of silicone shell, but empty.
Interesting.
Okay, and then you fill it with saline, which is just like salty water, basically, right?
Wow.
Yeah. So it's such a nice product. It's actually really simple.
Right.
But it works well. Now, how do we decide which one is best for the patient? Well, one is the most important factor. What does the patient want?
Right.
Remember, we don't do stuff here that is medically indicated. That's really what the patients want, right?
So it's their choice, essentially.
It's their choice. Some patients say, I'm not comfortable with silicone implant. And of course, we give them all the information, and as long as they know the difference and pros and cons
Right.
and all that, that's fine. I mean, we can definitely do.
Do you recommend a specific one to a patient who kind of has no idea? So if they came in and they said that they wanted to get an implant, but they don't have a preference, they don't really care, what would be your opinion?
If they don't have a preference, usually go with silicone.
Okay.
Yeah. Silicone implant tends to have more natural feel to it. Saline implant, if there is good tissue coverage, you might not be able to tell that this is a saline implant. Okay, and of course we have the implant also under the muscle. But overall, uh, if there is no preference, then we go over the pros and cons of each. Still no preference, we go with silicone.
Okay.
Yeah. And then the other question that patients ask, should we put the implants above the muscle or under the muscle? Okay, that's also a common question. And when we put the implant under the muscle, it hides it well. Now, we tell the patients this does not mean that the implant is fully covered with the muscle.
Right.
Just the upper part of the implant is covered under the muscle. And it prevents what we call edging, where you can see the edge of the implant here, and it's just not the look that patients want. Now, let's say the patient has enough soft tissue coverage here, enough fatty tissue, then you can put it under the breast, and some patients like that too, just kind of more of the natural.
Yeah, I was gonna say, so is it kind of to figure out which one would be most natural looking?
Yeah.
Rather than having a very unnatural looking breast augmentation. What is
and both look good, because we take a lot of measurements, we assess the patients, we examine them, and If they don't have a preference, because some patients, they do the research very well and they know the pros and cons of each, and they say, well, I want my implant above the muscle.
And they already
You
know when they walk in.
Yeah, they already know.
Yeah.
And I mean that's fine as long as they understand. If there's no preference, we go on to the muscle.
That makes sense, yeah. Have you ever had a patient with a very unrealistic expectation when it comes to a breast augmentation?
Yes. Yeah.
Do you usually have to say no?
Uh,
Or how do you handle
so
that, I guess?
so the way we handle that is just more communication and more education, just more discussions.
Right.
Okay, because the patient might come with expectations right here. Okay, but really here is what we can deliver. Okay, now if I know that maybe someone else can bring them up to these expectations, because something that we are limited on, maybe they need something or need a special device that we don't have, then I'll be more than happy to direct them to this person. But if just an expectation issue, there is a mismatch between what the surgery can do and the expectation, then we want to talk to the patient and make sure that we bring these expectations to become realistic.
Right.
You know, uh, and um, um, and make sure they understand what the surgery is about, what the surgery can offer them, and how every patient is different. Okay, and most of the time, we're successful. I remember I had one patient that was many years ago, maybe 8 9 years ago. Very nice lady, and she came to me for breast augmentation, and she said, "I want a very natural look. I don't want anyone to notice."
Right.
Okay. Then when we took her measurements and all that, um, we started to try different implants, and she wanted to go with the biggest implant possible. And I said,
Natural
well,
and biggest probably don't go in the same sentence.
exactly, and we discussed that, um, and I don't have a problem, like we can go with the biggest implant, but it did not match her body, did not match her frame,
Right.
and it was gonna look really strange, if we put it
Super unbalanced and
very
very
unbalanced,
unnatural,
yeah,
probably.
it's not gonna look good, and I told her that,
Right.
and I tried to tell her probably we need to stay, you know, with these smaller implants that will fit, um, your breast measurements, your breast width, all that. But she really liked these big implants, and they look nice,
So did she
they
end
look
up going
nice.
with the big ones?
I don't know because I apologize that I could not really help her, so I couldn't do her
recommended
surgery.
her else.
Yeah,
Yeah.
yeah.
Well, saying with like the unnatural or the bigger and then the more natural, what do you see more? Do you see people looking for the natural where people can't tell, or are you seeing more of almost a little bit unnatural and they want everyone to kind of know that they've had a breast augmentation?
So when you say unnatural, you mean what do you mean?
In the sense of you're passing someone on the street, it's very large, you'd be able to probably guess that they've had a breast surgery.
Oh, gotcha. Okay, okay. Yeah. So kind of like because the fake look is a nice look,
Right.
Also, of course, based on what the patients want. So
So I guess yeah, like are people leaning towards the more fake look or the supernatural?
like
You
subtle,
wouldn't be able to
natural.
tell. They've been
Yeah.
using like the term the ballerina boobs. I've heard like on social media of people where you almost would never be able to guess that they'd actually had breast augmentation done.
So I'll tell you from my experience. Yeah. Usually, what happens is patients start with a lot of patients. They start with I want something very natural, very subtle. I don't want anyone to notice. And then by the end of the consultation and after they try the different implants, usually that changes to the nice fake perky busty look.
Right.
And they love it.
Yeah.
So I would say probably there's a lot more. Um, I want people to notice more than I don't want people to notice.
That makes sense.
Yeah.
I've heard women say, if I'm gonna do it, I want everyone to know that I did it type
Yeah.
of thing. So
Yeah, exactly.
I mean, whatever makes someone happy, I guess.
Yeah.
Whatever they prefer, definitely. What is
The funniest comment, that this this lady was so funny. So she had um, so I did her breast augment. She's pretty young. She was mid 20s or something, you know. Very nice looking young girl. That was a few years ago. And we did her breast augmentation, and and she looked great. She looked awesome. And I said, "How do you like it?" And she said, "I hate it." And I said, "What?" She said, "I hate it." She's smiling like there's a catch somewhere, you know. I
Right.
was like,
You're like,
okay,
you don't actually hate it.
yeah. I said, "Why do you hate it?" That's a true story. And she said, "Because now when I go out on dates, no one looks at my face anymore."
I mean,
It's like, I'm sorry.
I can
I guess.
understand that. Yeah.
Yeah.
No. But that's what they wanted, I guess.
Yeah, no, she was super happy.
Do people see results like instantly when it comes to breast augmentation, or what is, and I guess the recovery process that goes hand in hand with that?
Yeah, so you see the difference right away.
Right.
But we tell the patients usually after the surgery the implants might be riding a little high, and that's normal. So you're not seeing the final results. You'll see a difference. You'll see a lot of improvement immediately, but the results will change over time.
Okay.
You know, and it takes maybe about 6 months or so for full tissue healing and remodeling.
Okay. What is the recovery like for someone? I mean, when would they be able to resume normal activities? What can they do right after, or what can't they do right after?
Yeah.
What does that look like for someone who might choose to get that surgery tomorrow?
So most of the patients can get back to like their work and just light activities, you know, maybe within 1 to 2 weeks. Yeah.
That's not bad.
Yeah, and then kind of go on no restrictions, maybe a couple of months or so after the surgery.
Okay.
Yeah.
I mean, that's not a long. Would you say that the healing process is, like, if you're honest, how painful is it? Like, what is it bad?
If I'm honest. So I'll tell you, because we do the procedures under local anesthesia with sedation.
Right.
So this helps with numbing the area. And the first day, you know how people wake up from general anesthesia, they might be just in a lot of pain because this area is not really numb, it's just the brain was asleep under general anesthesia, right? But what we do is we numb this very, very well. So even when patients are awake, they're comfortable. So overall, pain control is not really that bad. Most of the time, we give patients pain medications for 3 days after the surgery.
Right.
And I would say the majority of them, that's all they need. Some of them say, yeah, I just took a couple of pills and that's it.
Just a little bit, yeah.
Yeah, so it really is, it's
Nothing
not too
crazy.
bad.
I mean, you said you have people that travel from all over to do surgeries. I'm sure some of them have been breast augmentations, and if they're capable of getting on a plane at some point after, I mean, when you have a patient that does that, what are your recommendations? Are they able to fly home after their surgery the next day, 2 days, a week?
Yeah, I tell them to be here for a few days, you know, like maybe about a week or so would be
Right.
would be reasonable. Because we want to keep an eye on them and make sure that uh, they don't travel too soon, and if they need anything the first uh, few days when um, you know they just had fresh surgery, fresh incision, all that, that we're here for them and we can help them. So
No,
I tell them
definitely.
usually at least a week. Yeah.
I mean, it can be terrible if you're getting on a plane within a week to travel back home to your hometown. Because I would think if it was worse, then you'd be on almost bed rest for days. So.
Yeah, and you're in the airport and
Right.
you know,
Yeah.
and that's all. This
It's
can be
already a
tough on your
headache
body.
to
Yeah,
fly,
yeah,
let alone
exactly.
after a surgery.
Someone can bump into you or something, you know.
Yeah.
So, yeah.
Have you seen an increase in your people wanting surgeries based off of social media and like celebrity type of thing? Like, have you ever had someone come in with a photo of a celebrity as a reference?
Very common.
Very common.
Very common. Doesn't have to be celebrities, but at least from social media.
From social media, right?
Yeah, a lot of screenshots from Instagram, especially with breast dogs.
That's what I was gonna say. Yeah.
Yeah, and like I like this. I want to have this procedure, and sometimes from our website. So they look at the website and be like, yeah, I like this before and after breast aug. You know, that's the one I want. And and again, it comes down to, is it realistic?
Right.
Can this patient get the same result of this other patient or not?
That's what I was gonna say. Like, goes hand in hand with the unrealistic expectations. Because if they bring in a photograph of Kim Kardashian in their my size body, that might not be 100% achievable. So
Yeah, probably.
yeah, and in that case, you might have to educate them a little bit more on what they should choose instead.
Right. But I would say I'm really impressed with how much research the patients do.
Right.
Like usually when they come for the consult, they already have a lot of knowledge that it's very rare that I find a patient that does not really know the procedure, know the different types of implants, know the different details, pros and cons, all that.
Right. I would say most people probably do research because it's a huge decision to make to be able to have one of these surgeries, and it's alters your body and changes your life essentially. So I would assume most people do their research. Would that be like your one piece of advice to give to someone before like booking a consultation and wanting to come in, would be do as much research as possible?
Yeah, yeah, absolutely. Yeah, research, and then we're here to answer questions because sometimes you can get into conflicting information.
On the
You know,
internet.
and on the
Totally.
internet you can have something and the exact opposite and all that. So, but do research as much as possible and then come with questions. And then we can sit and discuss them. I don't mind questions at all. Actually, I like it when patients like pull, out of from their purse like this long piece of
Lists of
paper,
questions.
and yeah, because this means that they are very well informed or
Right.
they work on being very well informed.
That's definitely
And
important for sure.
very important, yeah. And you were asking about tuba and TUSBA also, since we're talking about
Yes.
breast augmentation. Tuba has been around since the 90s.
Okay.
And it stands for transumbilical breast augmentation. And with tuba, you just go through the belly button, inside the belly button. So really, there are no scars because the scar is hidden inside the belly button, right?
Wow.
Okay, so it's pretty cool. And then you do the breast implants that way, and very nice procedure. It was done with saline implants.
Okay.
Uh,
So for clarification, you're not taking an implant that looks like this and putting it through someone's belly button, right?
with tuba, yes.
Wow.
With TUSBA, we do.
Okay. Well, I'll let you explain that because I would assume that something. I wish I would have brought those over behind the camera or some
Yeah.
implants. I would assume that would not be going through anyone's belly button, but yeah.
Actually, let me get it real quick.
Yeah.
Yeah. So, yeah, I'll just use this one here. Okay.
So is that a silicone?
That's a silicone implant.
Okay.
Yeah.
Yeah.
So, and we can go over it here in a second. That's probably moderate profile. Yeah, moderate profile. Okay. So we'll go over that. But yeah, so with tuba, you basically place the saline implant when it's empty. Okay. You fold it kind of like, looks like a cigar, kind of thing. Okay. You fold it.
Roll it up.
Yeah. And you place it into the pocket that you create, and then once they are in the pocket, they have these tubes that are running through your tunnels coming out from the belly button, and then you can just fill them with saline, and here you go. Great idea. Very nice procedure, and different skill than your regular breast augmentation.
Right.
But patients love it because there are no scars on the breast. There's really no scar on the belly button,
Yeah.
or in the belly button, because it's hidden inside the belly button.
So,
And some patients see it as a confidentiality kind of thing. Well, I don't want people to know that I had breast aug.
right.
And the scar, even if it's faded, even if it's small, but it might
You
give
might
it
still
away.
be able to tell.
Yeah.
Right. I mean,
Exactly.
who wants a scar? Do you see an influx in people wanting that versus a classic breast augmentation due to the scarring?
I would say a lot of patients like it. Some patients don't like that it's saline because they want silicone.
Right.
And some patients say, I don't care, like the scar hidden in the fold, I don't care if I
Right.
have a scar there. And that's pretty much it. But then about 4 years ago, TUSBA came along. Sorry,
That's right.
more editing, huh? And if you think about it, when they created the first procedure, it was called TUBA, transumbilical breast augmentation. Did not really specify if it's saline or silicone, right? And I think the reason was it's just the given is gonna be salient. How can you put this thing through the belly button?
Right.
Right.
That was what I was thinking. I was like, there's
Yeah.
no way that could exist.
Exactly.
But you learn something new every day.
Yeah.
I'm sure people probably also didn't know this either.
Exactly. But it's been such an appealing idea because when you do tuba, and yeah, patients love it. But what about the patients that really want silicone, but they don't want scars?
Right.
Okay. And some people say, well, you can do the transaxillary, like through the armpit. Yeah, well, the scar is.
Okay, I've heard of that before. Do you
Yeah,
practice that
I
here,
know.
where you do it through the armpit?
I don't know. I don't do this approach.
Right.
You still have a scar, and if I can, create a pocket and get it without any scar at all, I'm gonna go through the belly button rather than the armpit.
Right.
But that's still a nice approach, just really whatever works best in the surgeon's hand.
Yeah.
But it's been very appealing, and tempting for surgeons to do tuba but with silicone.
Right.
And how can you do that? How can you? And then finally, Dr. Gabriel Patino. Now, let me actually start with this. So, the surgeon who published the biggest series of tuba, I was actually very proud to be the primary author on the paper.
Wow.
Yeah, and he was the surgeon I did my fellowship with. His name is Dr. Robert Shumway. He did tubas more than anyone in the world. Okay, so we published the series, and that was actually years ago. So probably has a lot more now, but it was I want to say maybe 2,200 patients.
Wow.
Tuba, so that's great. And actually, he did the very first tuba in Austria, and I was the assistant on the case. So
that's awesome.
Yeah, it was great. It was great. So
so you assisted with the very first
tuba
in Austria.
Yeah.
That's cool.
Yeah. So I was trained by him on tuba, and such a great case. So I was very fortunate. And then with TUSBA, now Dr. Shumway is in California. Now two other surgeons in California, Dr. Gabriel Patino and Dr. Jacob Hayavi. So they came up with TUSBA. Well, let's do the same thing because they've been doing tuba also. So can we put silicone implants? And they were able to do it and pioneer it. And I was trained. I know both of them very well. Great surgeons. And Dr. Gabriel Patino had a nice TUSBA course. So I went and got trained by him. And yeah, it's like tuba was just little tweaks. But yeah, can you put this through the belly button? Absolutely.
That's crazy.
Yeah,
so
right.
The same, like you just.
Well, if you.
Is the incision bigger? Can you explain just a little bit of like how in the world would you get that through someone's belly button?
Yeah, so it's like a magic trick, right?
Wow.
But yeah, the incision you might make it a little bigger if needed. Okay. But the thing is, I'll tell you. So when we do our breast augmentation, just regular breast aug, we don't really place the implant through the incision directly. Now some people do. I prefer to do something called non-touch technique, where you put the implant in something that looks like a cake decorator. Okay, it's called the funnel.
Okay, yeah. Okay. So like a piping bag for icing on a cake.
Yes.
Yeah.
Exactly.
Okay.
So you put it there, and then you just gonna squeeze the implant, like with the funnel, and now you have the implant. Of course, it's gonna take the shape inside the funnel. So now it's gonna point it here, and as it goes in, so let's say it's like that, right? And as you push it in, then it's just gonna slide.
Wow.
Right there.
That's crazy.
Yeah, think of it kind of like it's gonna take the shape of the funnel, and then as it goes through the incision, pushing it through the funnel, then it's gonna become like figure of 8, kind of thing, and then as it keeps going through the incision, now we have more implant here and just a little bit left here, and then it goes in. Okay, but it happens pretty fast. But the whole idea is you're just gonna use just how.
And so it's definitely very malleable. Yeah.
Yeah. Exactly. So you can really shape it. If you try to just kind of push it through the incision, there's just too much contact with the skin, and and it's really kind of even tough to kind
Get
of
it
get
through
it.
there,
Yeah,
right.
it's like you push it here and it just jumps here, and then you push here and it jumps the other.
Yeah, I'm just imagining like the size of a belly button and this whole thing just going through it and like that.
But even just through just regular breast log, same thing. So we use this funnel for all our breast logs.
Okay.
Okay. Uh, and we pretty much, you kind of put it in the funnel and then push, and then it goes right through.
Wow.
So now we do the same thing with TUSBA, with the transumbilical silicone, where we create our tunnel, and the tunnel is designed a certain way, it has certain shape and measurements. And then, initially, you push the implant into the tunnel, not into the breast, using this funnel, okay? So now it's gonna sit right here, okay? And now you can actually gently squeeze the implant that's inside the tunnel, and it's gonna go right up there.
That's crazy.
You wanna show a quick video?
Sure. I was gonna say, if it's able to be put on social media, you can share a video with me and I can edit it in and
Sure.
show the people that are watching.
Absolutely, let's see. Because I was just showing it yesterday, and I think I downloaded it. Let's see. Download. Here we go. Oh, here we go. I think it's this one. Now this here is tuba. See that? So you're gonna kind of fill the implant with saline. Actually,
Wow.
here that's just filling the sizer because this is air. So we're just gonna filling the sizer with air. But you can see this
Just right to the belly
procedure
button.
right here. Yeah. But I want to show you the other one. Which? Oh, here we go. So that's the funnel right here.
Oh wow.
Now this is just marking. That's not blood. That's just marking.
It does look like a cake.
Yeah, right.
Decorated piping bag.
So now we're gonna push. Oh, almost goes to the wrong tunnel. So now I'll just push it back to the right tunnel. Okay. And now it's inside the tunnel, right?
Something I have never seen.
Yeah, ready for it. And bam.
Wow. I mean, I know nothing about the human body, so I wouldn't be able to understand that, but I'm like, wow.
That's pretty cool, huh?
No, that's very cool,
Yeah.
and I would not have imagined that you'd be able to do that, so
Yeah, I'll
that's
send
awesome.
you this video if you want it.
Yeah, send me those, and I can put a clip in for you all to see what I just saw, because it was a little crazy, and you probably have never seen it in your life.
Alright.
Yes. Alright, I can edit this little part out. Is there anything else that you want to talk about breast augmentation wise, or should we move on to more of?
No, I think that's good.
Yeah, I feel like we got covered a lot because most of my questions got answered.
Okay, perfect.
Okay, so we've covered a lot about breast augmentation, so we're going to cut it off there and we're going to move on to talking about abdominal surgeries, such as a tummy tuck or a liposuction, and are there others aside from those two?
So there are a lot of different ways to contour the abdomen.
Okay.
You pretty much touched on the very common ones. Liposuction is probably the most common cosmetic procedure done, along with breast logs. And when should we do liposuction versus tummy tuck?
That was what I was going to ask. What are the differences between those two, and how do you choose which one is best for you?
Yeah. So always think of skin and fat.
Okay.
If we have a lot of loose skin that needs removed, if we have a lot of fat, or maybe we need to suck it out.
Right.
Okay. Just in general. So liposuction targets the fat.
And are they both classified as weight loss procedures?
Actually, both are classified as body contouring.
Okay.
Yeah. So just shaping the body. And sometimes you can combine them. You can do liposuction with your tummy tuck. So there are a lot of different types. So when we see the patients for consult, we go over that. We see what is the best option for them. Are we doing a tummy tuck? Are we doing a lipo? Are we combining? If we're combining, what kind of lipo tummy tuck are we doing, and so on. Okay. Yeah. So there are a lot of different ways
Right.
to contour the abdomen, and contour the back also. With the abdomen, because that's part of contouring the abdomen is contouring the waistline, the sides, all that.
So it
That
all
makes
matches all the way
exactly.
around.
Exactly, you're absolutely right. So we always talk about this. Think of a cosmetic unit, right? If you treat one section and you leave the section next to it untreated, that's all you're gonna see after.
Right.
It's like, oh,
It
this
would almost highlight the other area that you didn't
exactly.
pay attention to.
So you want things to blend and flow.
So it makes it all match.
Mhm.
So I'm trying to think of my next question. So you said that you can do both at once, but you also see a lot of people who choose one or the other. What would make a good candidate for choosing liposuction versus a tummy tuck, vice versa?
So in general, because this can be a very, very wide topic,
Yes.
but in general, let's say a patient that does not have loose skin, there's no hanging skin, more of just stubborn fat that they cannot get rid of.
Okay.
And a lot of people experience that. Like let's say after pregnancy, or maybe I gained some weight and after I lost it, I just have this blocked fat that doesn't go anywhere, or just with aging, a lot of people experience an areas of just stubborn fat, right? Males usually talk about the waist, call it love handles or call it whatever, but
Yeah, I've heard that term before.
yeah, but the waist, it gets very stubborn, and then start putting uh, fatty tissue in the waist here, and you cannot get rid of it. And people try to diet and exercise and try all kind of things, and eventually say, I'm just getting older and that's how it is. It's like, well, it's just stubborn fat, it's
Right.
blocked fat, sometimes we call it. And liposuction is great for that. And uh, a lot of female patients would notice it in the inner thighs, outer thighs, also around the waist, uh, arms, and so on. So when we don't have skin to remove, we can just do liposuction only. If we have skin to remove, let's say, and not really a lot of fat, then it's skin excision only, like a tummy tuck, for example. And if you have a combination of both, then you might combine the procedures.
Combine the two.
Yeah.
So a tummy tuck is based more around the skin rather than the fat.
Yes.
Okay, that makes sense. And then you had said people deal with like the thighs or the back of the arms or things like that. Do you provide liposuction in all of those areas, or is it just solely the abdomen that you can have liposuction done?
Yeah, no, you can do liposuction in a lot of different areas. Liposuction targets the fat that
Okay.
is under the skin.
Right.
So we can do liposuction to pretty much every area of the body. So one of the common areas is shaping the jawline.
Wow.
A lot of patients say, hey, I have a double chin, I don't like it. How can you lose a double chin? How,
Yeah.
like, how can you diet to lose
What
this
exercise
small,
can you do to
yeah,
get that to go
exactly.
away?
So it gets very frustrating for patients, and it is genetic.
Oh,
you know?
wow.
And they say, yeah, like everyone on my mom's side, they all have the same chin. Okay, so how can we lose that? All right, and we do liposuction. Now, usually when we do liposuction in this area, we do it with ultrasound, and we also do some Renuvium to tighten the skin, and we blend it to the jawline, so we have like a nice shape of the jawline and define it.
Okay.
Because the jawline is very important. Actually, a lot of times, what would catch your eye first in someone that you see is a jawline.
Their jawline.
You know?
Do I need liposuction to my jaw?
No, you don't need anything.
Do I have a double chin? Hopefully it's not genetic for my family.
Yeah, but it gets frustrating for patients,
Right.
And then the other thing that we also talk about when since we talk about chin contouring and submental area is maybe sometimes we need to add some volume to the chin.
Okay.
For example, some patients have receded chin, and which means that if you think of an imaginary line going from your lower lip down, it should be with the chin on the same
level.
on the same level.
Yeah.
But if you do this and the chin is kind of pulled back a
Back
little
up.
bit, then it's called retrognathia, or basically it's just sometimes people call it weak chin. I have a weak chin. I
Weak
need to do
chin.
something about it, right? Yeah.
Do people use filler for that? I've
Yeah,
seen.
you can use filler for that. You can use fat. You can
Okay.
inject some fat. You can use chin implant,
Wow.
which really works great for them.
What is a chin implant? Can you explain that?
Absolutely. So the chin implant is a silicone implant. It's anatomical, so it takes the, or is designed in the shape of the chin. Okay. And uh, usually we do it from here. Now you can also go from inside the mouth, but usually from here. A small incision hidden behind the bone right here. Okay. And it sits on the bone, and you secure it in place. And that's a nice small procedure, but it gives nice projection of the
Right.
chin. Now, um, we can do a lot of things with implants, and implants used to be very popular before fillers,
Became a thing.
became a thing, right?
Would you recommend an implant over filler? Especially for something like that with like the chin.
So I talk to patients about the different options because a lot of patients get fillers and they don't know that there's the option of implants.
Right.
And they go and they get fillers and fillers, and every year they get fillers, and they keep.
Because you have to continue doing filler. It's not something that's permanent.
Right. Now there are permanent fillers, but the majority of fillers that are used are called HA fillers or hyaluronic acid fillers, and they are great, but they go away, and you have to keep doing it. And I tell patients, listen, if you're gonna keep getting the same thing over and over, you might need to think of something more permanent.
Right.
I don't like to start with permanent, because maybe you won't like the look. But if you know how you're gonna look like and you saw it already, maybe you can look at something more permanent. Which, in a way, there's a little, I would say, just for lack of better terms, conflict of interest when the physician tells the patient, stop getting the fillers and get something more permanent. Because this means that this patient will stop coming to you once they get the more permanent thing, right?
Right.
But you're doing the right thing for the patient.
Definitely.
And
so, the patient should be more important than
of course
the money that they get from providing the services of the
filler.
So
do I want the patient to come every year and get filler when there's actually something else that's a better option maybe for them, that is more permanent, and they don't have to keep spending all this money over the years, and eventually it looks unnatural.
For the patient, it might be financially, brain farted, more financially stable, or what am I trying to say? Financially, it makes more sense financially for someone to do the permanent rather than years and years of paying for the filler, because filler's not cheap to do an injection of like the hyaluronic one. So, yeah, I mean, for the patient's sake, they might not even know that exists. I wasn't really aware that you could do implants for things in the face, such as like the chin. Are cheekbones something that they do? Yeah. Yeah, you can put chin implants. You can do mandibular implants where that one kind of like a wider jaw, like kind of strong jawline, right? Very chiseled jawline.
Yeah, very chiseled. You can put mandibular implants.
Wow.
Okay. And there are of course other types of implants, but these are the main ones. You can put temporal implants, which I really like actually. When patients have hollowness in this area, it just looks empty. Okay. Now, some people put fillers there. I'm not a big fan of fillers in this area, but a small procedure like temple implants through a very small incision hidden inside the hair.
Wow.
It just fills this area and makes it look nice and useful, and it's permanent.
Yeah. No, that makes sense. I didn't really know that was an option. I've just always heard of everyone kind of doing the filler for things like the cheekbones or the chin, or just like facial balancing basically that people will do through a med spa using Botox and filler. And there's a more permanent option, which would be maybe a little bit more expensive for upfront for the one time, but after that you wouldn't have to continue spending for years and getting your face injected with needles. So that might be a good decision for someone who has been doing years of filler instead of continuing that. Yeah, absolutely. Yeah. So for abdominal, we'll get back to that with the liposuction and the tummy tuck. I know we talked about like the recovery process for breast augmentations, but is that similar to the liposuction or tummy tucks? Is it more invasive surgery where the recovery time is longer, more painful? Explain that for me a little bit.
So with liposuction, based on how aggressive the liposuction is. So if you're doing liposuction, that you're removing fat, but you're not doing sculpting, then usually recovery is a little easier. Okay. If you get to do sculpting, where we start to etch the muscles, okay, and give nice definitions of the abdomen, or cut a six pack, okay,
I did not know
then
you could do that.
yeah, absolutely. And now this one recovery can be a little tougher,
Okay.
you know, because you're working on the muscle. Anytime you work on the muscle, it hurts, you know,
Right.
and the muscle goes into spasms and all this stuff. And of course, you need, you know, if you do more aggressive liposuction, you also need to make sure that you get your massages after the procedure, like your lymphatic massages, and we also do ultrasound massage and all that.
And I've heard that like the lymphatic drainage massages are very important. You almost kind of have to do that after surgery, right?
Yeah, very, very highly recommended.
Right. And
Yeah.
you have someone here in office actually that's in your building who provides those services for your
Yeah,
patients,
yeah,
right?
we have, yeah, they're independent, they do a great job, you know, but yeah, they're on site.
Yeah, that's awesome. So then you kind of can be all in one place for what you need done instead of having to find another place to go to.
Yeah, absolutely.
You said sculpting the muscles and talked about almost like a six pack. So when you think of liposuction, at least for myself or maybe someone else, you might think that's someone usually who's larger and they're just trying to get rid of the stubborn fat and things like that. Can you do this sculpting that you're talking about on someone who doesn't have fat per se, that to kind of give them that definition in their abdomen?
Yeah, so that's really a great question. You're right, yeah, usually people think of liposuction as just they have extra fat that I just need to get rid of. Um, but there's liposculpting, where we actually are sculpting. So we're not really debulking fat.
It's
Okay.
more on the muscle than it is fat.
Yeah, it's
Yeah.
just more kind of fine work, more superficial work, you know, like kind of closer to the skin. And now we're looking more into shaping. I'm sorry, not just shaping, but shaping and also creating definitions.
Right.
Okay. And I see a lot of people, a lot of young females. I'm not even talking about just six pack in males. I'm talking even about just usually females have four pack, right? Yeah.
We can't have a six pack?
You don't want a six pack.
No, we don't.
But but I see a lot of young females who are, you know, athletic. They're in good shape, um, ideal body weight, all that. But there are no definitions at all on the abdomen. You want shadows on the abdomen. You want to see
Yes.
shadows, right? And when it just all looks the same, for a lot of females, it actually makes them self-conscious.
Yeah.
You know, even though there's no weight issue, there's no issue at all.
They're very thin, but they just don't have that definition that they're looking for.
Exactly.
Right.
And then what we do here is we sculpt the muscles. Now, every now and then, you know, girls will say, "I want like really a chiseled look," you
Okay.
know, like just really cut. But that's the exception. That's more for our male patients when they come and say, "I want six pack, I want the oblique cuts," you know, and
So
and
you
all
can
that.
do that
You
without
can do that.
being in the gym every single day.
Yes. Yeah.
So some men might be faking their six packs. Ladies, they might be having
But
cosmetic
we're showing
surgery.
their true six pack, right?
Yeah,
The six pack is there. We're just showing it.
we're just making it appear better. Yeah.
Yeah.
No, that makes sense. So if someone were to get that
But I'm
procedure,
sorry for.
Yeah.
Just for females. So what we do is we just create soft definitions.
okay,
You know, like what we call mid-depth sculpting, and you can see the rib cage. You can see, you know, just the lines of the muscle, and it looks nice and natural and soft.
Yeah.
You know, uh, without the bodybuilder look.
looking
You know,
to
yeah. Except if they want it, then we can do that.
Yeah. It's whatever the patient wants. So if they want that, I guess you could do it. Would doing something like that over time, once that's completed, if someone were to continue being very athletic and being in the gym and working on those muscles as well, could they like achieve a more defined look through the gym, or would it stay exactly how you
No,
do the procedure?
no, it will just keep getting better and better, basically.
Okay, yeah.
The only time that it can be tricky, sometimes we create six pack. That's a secret, okay? It's
Don't
now
tell
kind of
anyone.
getting getting to the tricks of some tricks of cosmetic surgery. So we can make someone look like they have a six pack, but they really don't.
Wow.
But just by sculpting the fat to make it look like six pack,
That's crazy.
right? It's a lot of fun actually.
No, that's cool.
Okay.
I mean,
Because let's say someone has maybe weak muscles or does not really have the definitions or his six pack is not really that strong, you know, because usually we just go and sculpt what you already have,
right.
But let's say someone does not have the shape of six pack, then we can do what we call differential liposculpting, where basically I'm going to leave kind of blocks of fat here. I'm not going to suction them out. I'm just going to do some conservative liposuction. One, two, three blocks of fat here, three blocks of fat here, and around them I'm gonna go like really aggressive with my liposuction. So now it looks like you have six pack, right?
Yeah.
Okay.
That's crazy.
When you really don't. So now the tricky part about this is, let's say if they exercise and they work out in the gym and all that, then they're gonna start building their own six pack and it's gonna show, right? But let's say if they do a lot of exercise like cardio and fat burning stuff, but without really working on their core, then they might lose this fat,
That you've sculpted.
that was pretending to be muscle.
Wow. Yeah.
Make sense?
Maybe it would if you did that, you might have the motivation to then
That's usually
lose
what
that
we see.
and
Yeah.
go sculpt
Patients
your
love
own.
it. Yeah, usually
Yeah.
patients love it because, like what happens is a lot of people try to work out and and let's say they try to get defined, and they can't, not because they do anything wrong. It's just it's very difficult to be in the gym for 3-4 hours a day, and sometimes also it's your genetics. You just
I was
will
gonna
not
ask,
get
is that a myth? I've heard that before, where your genetics play a role in the way that your abs and the definition
Oh, absolutely,
show up.
absolutely.
Yeah.
Yeah. So then once you do this, once you help them with this part, then now they're motivated because they've been trying. That's what they always wanted.
Right. And they
So
can
now they
see
don't
it.
want to lose it. Now they can see it.
Yeah.
Yeah.
No, that's awesome.
Mhm.
As far as abdomen, I don't have a lot more questions. If there's anything that you wanted to touch on, I know we're getting.
Maybe one quick thing since we're talking about tummy tucks, because that's a common question for patients. A lot of patients that have separation of the muscle, it's called diastasis, they think they have a hernia.
Wow.
Okay, so yeah, I always like to talk about that because it saves the patients maybe some worry about that, and
So hernia would be something medical, right?
hernia will be medical, yeah, would need to be fixed. But some patients say, yeah, I have a big hernia. I was like, okay. And then we start to examine them. It's like, I don't feel a hernia. And they show you, like, when they kind of doing, like, kind of half a sit up. Then you see this oval bulge, kind of starting from the sternum
The top.
down to the belly button.
Wow.
Okay, that's usually how it presents. And this is called diastasis of the recti or just muscle separation. It can happen, again, genetic, or with pregnancies, weight gain, different things. And what happens is the muscles, our rectus muscle that kind of form the six pack, instead of being in the midline, it just kind of goes to the side a little bit. So instead of having a line of tissue in between, it becomes a sheet of tissue in between, but it's not a hernia. The hernia needs a hole, an actual defect, where things that sit inside your belly herniate through it, right?
Right.
That's not the case here. It's just you have a sheet instead of a line, and the muscles are on the side. And patients sometimes know they have it. Some patients do not know they have it, and they say, I need liposuction. That's one of the common presentations of liposuction. And you examine them, it's like, "Oh, you don't really have a lot of fat here." But they say, well, I have this round shape of my belly. I look like I'm pregnant. And that's usually separation of the muscle.
Wow.
Because when the muscle separates, now we have this sheet that's not really strong, and now things just bulge out.
Yeah.
Right? And other patients, they notice that, yeah, I don't know why, I'm just weak. I just have a weak core. And maybe it's not weak, maybe just the muscle is sitting to
On
the side.
outside.
And the reason they say that, they say, anytime I'm trying to get up from sitting, I'm trying to get up, I have to do this.
because their muscles are on that side helping them stand up.
Exactly.
Yeah.
So they cannot go straight.
Straight up.
They kind of have to kind of lean because now they're using more of the sides.
Yeah.
And I had a patient that had severe diastasis, and when we did her surgery, uh, after she recovered and and she was kind of back to moving normal, she said that was the first time she was able to go from sitting to standing without leaning
Straight
to the
up.
side. Probably was the first time in like 20 years.
That's crazy.
Yeah.
Because most normal, like, it's pretty normal for everyone to just stand up that way. So,
Exactly.
and having that change was probably life changing, honestly.
Mm-hmm.
Yeah.
Yeah, absolutely. And if the patient has this, then maybe they have separation of the muscle, they just don't know it.
Right.
If they feel that when I try to stand up, I'm kind of lean to the side. Other patients also talk about tummy tucks. When we do the tummy tucks, we always lift the pubic area. Because you see some surgeries where the pubic area is not treated with the tummy tuck, and it just leaves like we call it monstosis, where basically the pubic area is just droopy,
Droopy.
kind of thing.
You don't want that.
Yeah, you don't want
Yeah.
that. Patients, and again, we talk about a cosmetic unit, just everything should just flow, right? But a lot of patients notice if they had, not all of them, but some, if they had some problems with the urine, like some incontinence or something, that actually this improves after the tummy tuck. Like, well, we didn't do anything in this area except tightening the pubic area, and this basically gives more strength,
Wow.
and gets rid of the laxity of the pubic area, and helps actually patients with incontinence sometimes.
That's awesome.
So yeah.
Kind of helps a lot of areas just to do the one thing.
Yeah, and the most important is just how patients perceive it and how they fit in their clothes, how they look, and I'll tell you this just last story.
Yeah.
This was actually, I think, in 2015, 2016, but I never forget this patient, a sweet lady. So she was, I want to say, maybe late 60s, early 70s, and she was getting a tummy tuck. And I said, okay, we put the incision just very low, we put it here, so you can easily hide it in a bikini, okay?
Right.
And she started laughing, she said, I'm not gonna wear a bikini, okay? Don't worry, just put it anywhere, I don't care, okay? And I said, well, you never know,
You
okay?
might.
Yeah, I'm gonna hide it anyway, just in case, all right? And then she had she had a trip to Florida after she recovered, and she said, she came to me for follow-up and she said, guess what I did yesterday? I said, you went bikini shopping, right? She said, yep.
And she wore the bikini.
And she wore the bikini.
Wow.
And I was very happy for her. So she, like she was.
Gives them that confidence, especially you said she was an older lady, like she probably hadn't been in a bikini in years, so being able
That's
to
what she said.
Restore that confidence within someone that they probably had when they were in their 20s.
Yeah.
Is incredible, no matter the age. So.
Exactly.
Yeah. And I think that's probably why you do what you do is.
It's great, just for the patients to trust us, just to be part of this.
Right.
It's a big thing, and it means a lot to us,
Of
so we
course.
want to do the best job we can to make sure that they are happy with their results.
Yeah. And that's why you have such great reviews. Well,
thank you.
Those are all the questions that I have for Dr. Akkary today. We will be back probably to do another segment on something else. If there's anything you guys want any questions about or any type of procedure that you would want him to explain, just let us know. Send us a message, leave any comments, and we will cover those. Thank you for your time today.
Thank you.
It was great learning a lot of different things. So I'm excited
to
to
appreciate it.
get this out there for everyone. But
all right. Awesome.
We'll see you next time.
All right.
Bye.